Thank you. New for you right now at 4:30. A brand new study from Yale University shows there are benefits to catching a cold, and a major one, it may actually protect you against the coronavirus. Joining us live right now is Dr. Foxman, an immunobiologist at the Yale School of Medicine. Doctor, thank you so much for joining us today.
Happy to be here.
Well, let's start with this study. What does it mean? What happened here? What did you guys look at?
Well, a lot of people are familiar with the way that vaccines protect us against a virus like COVID. So that's one type of immune response. What we studied was a different type of defense that happens really fast, and it's triggered by basically all viruses, and it also protects against all viruses. And we asked the question whether if you trigger this kind of defenses with the common cold virus, will that protect against COVID? And the short answer is yes. If we expose the cells that normally get infected by COVID to the common cold a few days before, they're then protected against COVID.
So is there anything that anybody can do to maybe protect themselves as flu and cold season? Obviously the flu is different, but as cold season would pick up again?
Well, of course, I'm going to say that the best way to protect yourself against flu or COVID is vaccination, because we have safe and effective vaccines for both those viruses. But what this does show is that what this study does show is that there may be something going on when sometimes someone gets exposed to COVID and they don't get sick versus someone who does get sick and the infection really progresses. Having a recent exposure to a different virus could actually be one of those factors that tips the balance. And there's actually even medicines in development that mimic this same type of defense and that are being tried in clinical trials for COVID and other new viruses to give us more weapons in the arsenal against these new viruses that like COVID if needed.
You know, when it comes to COVID, it seemed like timing was everything. Is timing, especially with the vaccine, is the timing an issue for a treatment according to your study here involving the cold?
Yeah, exactly. Actually, the first part of our study just looked at patients who had gotten COVID just within the last day or two and looked at the defenses in their body and how those defenses went up after they got the virus. And it showed that there's this lag time of a couple days after you get the virus before these defenses go on. So that's what allows a virus to start growing, is that there's this lag in your own natural defenses. And that's what prompted us to ask, well, how could you get those defenses going faster? And one way to get them going faster was to have an infection right beforehand with the common cold. That second part of the study, we didn't do that in patients. We did that in airway tissue in the lab because we didn't want to infect people with viruses. But we did observe.
We have enough of that going on, that's for sure.
Yeah, exactly. But as we all start reopening and the masks start going off, we can expect that we're probably going to see common colds again. And so maybe this is a silver lining aspect to it.
Well, that's some good news. We like some good news from time to time. Dr. Foxman from Yale, thank you so much for joining us this afternoon. The research that you guys do and that all you medical professionals have been doing over the past year and a half is just remarkable when you see how far we've come.
Thank you very much. It was great to be on your show.
We'll talk to you soon.